I'm going to introduce our presenter. Danny, are you there? All right.
Yes.
Danny, I'm going to cue you up a little bit here. I see that you are the, and I want to give a big shout out, by the way, to Lisa Wall. She was on our board. She's now just a happy member of the Griffin Neighborhood Association. And she helped us and she reached out and got a hold of Danny. So I want to thank her for going above and beyond and helping us make contact with somebody that is an expert in what I think is a very hot topic on everybody's mind. And with that, I'm going to introduce Danny Veenhouwer. Am I saying it right?
Yes, you are.
Oh, I'm shocked. Who is Senior Manager with Pharmacy Services at Providence St. Peter Hospital. With that, I'm sure everybody's tired of seeing my face, so I'm going to put you up live.
All right. So before I start the presentation on COVID vaccines, hopefully it will be a little educational and informative for what's in store here. So I'm Danny Veenhouwer. Like Mike said, I'm the Senior Pharmacy Manager at Providence St. Peter Hospital. I've been there for about 10 years, historically an ICU pharmacist, now in the management role. And right now with the COVID-19 going on, I am the primary manager, you suppose, of the COVID vaccines, that being the Pfizer and Moderna vaccines and the storage and allocations and such. So with that said, I suppose I'll get started. I'll share my screen. Okay, let's see. All right, can you see my screen?
Yes, they can see it now.
Okay, I put on the automatic subtitles as well for those who don't have good audio. So my presentation today for the Griffin neighborhood is COVID vaccines. So what's the difference with the vaccines that are out there? What's their availability and also what's the safety of these vaccines? So to start off, just to let you all know, I have a financial disclaimer. I don't have any financial conflicts of interest by giving this presentation. Nobody's paying me. I have no relations with any drug manufacturers or anything. I don't even know if Providence Hospital knows I'm giving this presentation. So completely unbiased. All right, the table of contents here. I'll do a brief overview of what's the disease. I'm sure we're all familiar with that, living with the coronavirus in our communities and in the world for the last year. So I'll be brief on that. And then I'll cover what's really the differences between the vaccines that are coming down the pipeline that are currently available, and then the safety of them and the availability. And I'm sure that's what everybody here is really looking to find out, like, when will they be available? When can I get the coronavirus vaccine? So a brief overview of the virus. So the coronavirus disease 2019, otherwise known as COVID-19, that's just acronym, corona for the co, VI for the virus, D for disease. It's caused by the SARS-CoV-2 virus, and that's the picture on the right here. As you see, it looks sort of like a halo or a crown, and that's why it's in the coronavirus family. Why is coronavirus as I guess pathogenic and as harmful as it is? So coronavirus isn't really an uncommon virus. We have a lot. In fact, all the ones in yellow on this slide, those are common cold viruses that we know. They've always been there. In the beta family of the coronavirus, though, you get the bad ones. They're closely related. We have the MERS CoV virus, the SARS-CoV-1. So MERS was in the early 2000s, and SARS was in 2012 or so. And now we have the SARS-CoV-2, as we know, COVID-19. And if you've been to the grocery stores or outside of your homes, you see this stand away 6 feet from each other. That's mainly because the exposure to this is through respiratory droplets, typically within 6 feet of an affected person. And if they're aerosolized, they could hang out in the air and possibly travel distances greater than 6 feet. And less commonly, what we call fomite transmission. It's if you were to sneeze or cough and your respiratory droplets get onto, let's say, a counter, and then someone else touches it, it's possible there would be transmission in that route. And less likely, still sort of unknown in body fluids and such. A lot of you may have heard, especially in the beginning, this is just a bad flu. So this is directly from the CDC in the last 10 years of flu data in the United States. As you see, in each of these cones each year, and it represents the total amount of illnesses, hospitalizations, and then deaths way on the top. The numbers I put in here for on each cone is the percent of people who succumb to the flu each year, so the deaths involved. And we're sitting at about, you'd say 0.1%, maybe a little higher than that for the flu. And that's versus the studies they did with COVID-19 is the case fatality rate's about 2.3%. And that's about 20 times as harmful to us than the flu. So it definitely isn't a flu. It is a very serious respiratory infection. And just recently, this is as of January 26th, COVID-19 became the #1 cause of death in America. So at that time, we had about 3,050 deaths per day. We're breaching 4,000 now. So it is touched a lot of people in this country, whether it's close family or friends, and definitely the communities. That's a little bit about coronavirus, just to set the tone here. So let's talk about some of the vaccines. What makes these unique? So right now, these are the ones that are in the news. We have the big six, Moderna and Pfizer. That's what we have available in the United States at this time. You may have heard of the Oxford partnership with AstraZeneca, and the UK has now approved that one for use. There's the Johnson & Johnson one, which is still to be approved. Got Novavax and Sanofi and GSK, they're big pharma companies that are anticipating release sometime in the near future. Before I talk about the ones that are out here, as you know, there's a column saying the dose schedule, and right now Johnson & Johnson, it's a single dose. So that'll be a big thing if that ever happens. Although you might have saw even in the news today, as of hours ago, there's research studies showing that the Moderna and Pfizer vaccine with single doses may provide up to about 92% protection against the coronavirus with a single dose, which is pretty impressive. So we'll see where that goes. But right now, what we have is 2 mRNA vaccines. There are new, what we call it, new vaccines. What makes them so new? Well, what really is new about them, it's the first time we've had an mRNA vaccine that has been used to prevent infections on a extremely large scale, like global scale. Initially, mRNA vaccines are really honed down and developed for the SARS virus and also other viral infections. This technology has been well established. It's actually been since about the 70s when the research has started. It's just, we've been, I guess, building and building upon previous research for the last 30, 40 years. mRNA insertion techniques is what really has taken off lately, how to get that into the human body. Really, mRNA, I'll talk a little bit about it in some feature slides, but it's a pretty simple thing to build in a lab. I mean, you can buy the building blocks for it on the internet right now, pretty cheap. So what is really new is this large production in factories to distribute to large populations versus just in like a research lab at a major university where you can produce like one in a week or something like that. So that's what's really new about these vaccines. There's nothing really else new about it. Safety, historically, I just want to show this. This isn't anything about the coronavirus vaccine. This is just how normal vaccines work. Typically, up here, as you see, there's pathogens or antigenic things, chopped up viruses, or perhaps so an attenuated pathogen. That just means a weakened virus. They made it really weak somehow. It's live. Sometimes they chop them up into little bits. Sometimes they make just the proteins of a virus, and then they inject into you. You have these memory immune cells that touch it, and they make antibodies, and those antibodies give you long-term immunity. And that's usually how the vaccines work. I mean, these are things we're injecting to our body that are not part of your body, so you do mount quite an immune response to some of these classic vaccines. What's a little bit different about mRNA is we have DNA, it's the building blocks of life. We probably heard that. Well, DNA, it's a one-way path to make RNA. And RNA is the cookbook of life, you could say. It's a recipe, and your body reads it, and it makes proteins. It makes everything you're made of. So your body is, you can say, a baker. mRNA is the recipe, and your body can make proteins. So how does this work in the vaccine? Well, with this technology we have here, we're able to stabilize mRNA, and we can just build it by taking the four nucleotides mRNA is made of, pop it in a machine, it spits it out, and they put it in like some fatty substance. It's called a lipid, and that gets into your cells, and then your cells can read that recipe. It never gets into like your DNA or anything like that. It just floats around in the cells with all the other stuff. The things in the cells will start producing that recipe, and the recipe is for those spike proteins on the outside of the virus, which is why we call it coronavirus, the thing that looks like a halo or a crown. It makes those and puts on your normal cells. These mRNA molecules only last about 2 days in your body. You probably heard people do have adverse effects for about 1 or 2 days. That's because that's how long this lasts. And the proteins it makes, those might last only maybe another day or so after that. And then they're gone. But that's enough time for your body with those immune cells to figure it out and provide a long-lasting immunity. So here's a recent study. This was actually the big one for the Moderna vaccine. It was in New England Journal of Medicine. It's the safety and efficacy of the vaccine. So the study here, they used 30,420 participants. The Pfizer study is very similar, and they used 75,000. And this was before it got to anybody. Ultimately, the safety up here, you can look at the infographic in the top right. With the first with the first dose, about 84% of people get an injection site adverse effects. So that would be some pain, maybe some swelling and redness around the injection site. I did have a sore arm for a couple days when I got mine. It's okay. I get those with the flu shot too. And then after your second dose, About 80% of people have some adverse effects, being like headaches or fatigue. Maybe you're tired or have some muscle pain. So about 80% of people have that. Myself, I did not. I don't think I'm that old, but you know, the older you get, the less chances you do have to get these adverse effects. Not everyone's going to get them. It'll be, some people are just fine. So that's the safety. It's, remember, this recipe gets injected, your body reads it and makes some of these proteins last a couple days, and so really you're just mounting this immune response, and those are the typical effects of an immune response: is just fatigue, headache, tiredness. It could be a fever as well, temporary. But as for the efficacy, or how well does it work? Well, this chart down here shows the rate of COVID infections in days after receiving the injections with these two arrows. And as you see, with placebo, meaning they just got probably some sterile water, the rate of infection was still up near the average rate of infection in the community, while the Moderna vaccine proved there's almost no infection. In fact, the ultimate conclusion was that it was 94% efficacy against preventing symptomatic COVID-19. So that means 94 out of every 100 people who would be exposed to coronavirus wouldn't have a symptomatic infection. So can you still get an infection or get exposed to it? It's possible. That's still some future research, and that's why we're still promoting wear a mask just in case, even if you do have the shot. These are highly effective medications. And just as a sub note, I didn't have this in my PowerPoint, but I was also reading today, like in Israel, they had, I think, 520,000 people get infected, and they've had zero. 520,000 people with vaccines, and nobody has got infected. So that's good news. All right, so the availability. So this is probably what you're all interested in. And when can I get the vaccine? Well, as of February 17th, there's been 181 million doses of vaccine distributed and administered in the world. Of that, we have about almost 58 million, it's like 57.7 million in the United States already given. So I think we have a pretty big test group if it's working or not. And so far it's showing it's working and it is very safe. Here in Washington State, we've already had 1.2 million vaccines administered. So quite a lot. And we're averaging about 26,000 a day. The Department of Health is hoping we get up to that 45,000 a day mark. We'll see if we can do it. As for availability, so there has been some hurdles and some hiccups. I know there's a lot of people still wanting to get their vaccine that are eligible. So this is for the week starting next week. There was 436,000 doses requested, and the state only has 263,000 to give. So that's a large disparity. We sort of know how much we're going to get. There's also news articles saying the United States is getting a whole lot more coming our way, so maybe those numbers will increase. But one good thing is the federal government, for the first time this last week, has given the allocation out to the Department of Health for multiple weeks. So every week, basically, they'd be watching their emails or waiting for a phone call to see how much they're going to get. Now they told them how much they're going to get for the next 3 weeks, and it's about this amount each week for the next 3 weeks. Just a decent amount. So what's the plans for Washington? The plan right now is where we're at is the traditional delivery system. So we're going to be using hospitals, just like Mason General. I know I've been doing clinics, St. Peter Hospital, Centralia Hospital, and the surrounding clinics as well. They'll be using pharmacies, and that should be up here soon. And then other workplace clinics, doctor's offices and such. They're hoping to move to more enhanced delivery systems and mass vaccination clinics. And you may have heard that Amazon has had a big clinic in Seattle. I think they might have had a couple. I mean, Disneyland and Dodger Stadium have had massive clinics as well. So those are the goals of Washington, to get these bigger mass vaccination clinics going. Also, like mobile vaccination teams, just pop-up clinics. Hopefully, just drive up and get it. But this is where we are now. This is the most recent timeline plan from the Department of Health. And we're in the winter setting right here on the left. We're in tier 1, group 1B, tier 1. So that includes 1A, 1A, tier 2, and B. So that's healthcare workers, our first responders, those working and living in nursing homes, and people over the age of 65, or multi-generational households. So this is more of grandchildren, grandparents, not so much people and their kids. So those are who qualify to get the vaccine right now. What's coming up, and this is a revised chart. One of my students gave a presentation on COVID vaccines just about 3 weeks ago, and this chart looked much different. They actually had month to month. In February was when they anticipated 1B tier 2 would happen, and well, we're over halfway through February and we're not there yet. So I'm expecting this in the next couple of weeks, where people over the age of 50 who work in high-risk settings, such as teachers and grocery stores and agriculture and close quarters, jails, those places will be eligible as well. And then we're looking sometime this spring, hopefully, people over the age of 16 with 2 comorbidities or more underlying conditions. So I looked at the list, and those included a body mass index over 25. So just being a little overweight, it wasn't even they had obesity, morbid obesity as well, but just overweight was a comorbidity. They said asthma, any respiratory thing, if you have COPD, asthma, if you have any heart issues, if you have congestive heart failure, things like that, or if you have any kidney or liver comorbidities, those count as well. I believe smoking's on there too. So diabetes, all of those. So a lot of people will qualify in this group. We do want to take care of people who have been shown to be at higher risk of severe infections, that's for sure. And then moving on, we got the high-risk workers under 50. So if you're of normal health and you're working in these places such as schools or grocery stores, or if you're working within close proximity, that being within 6 feet of someone for greater than 3 hours during your day, you would classify to be able to get it in that group. And then we move to the feature phases, and that'll probably start in the summertime here. And that is phase 2, 3, and 4. This is sort of a different view here. Phase 2, 3, and 4 is up here. We're looking at essential workers for phase 2 that were already covered in phase 1. Phase 3 is basically anybody working in functioning society, and 4 is everybody else. So a catch-all. Like I said, we're in group 1B, tier 1. How do you find out? Because it's complicated just knowing, like, oh, I'm in this tier. How do you find that out? Well, you go to findyourphasewa.org, or you can simply Google Phase Finder or any Internet Explorer type thing, and you'll get the first site on the Department of Health. And if you click the Vaccine Phase Finder, I'll ask you to fill out some information. And with the information you provide, this is all a, Boy Scouts honor type thing. Your honesty for your classifying your phase. It'll tell you what phase you're in and when can you get your vaccine. It'll also put you on a list so that you will get possibly notified when you are in the correct group. After that, you'll be able to view the vaccine locations and register. So there's a vaccine locator, and that tool will, if you zoom in on Washington State near where you live, you'll see all the locations for the vaccine. Right now, if you're to go to that site, you'll see Costco on there. You'll see Kroger, so QFC and Fred Meyer. You'll see like Mason General, and you'll see Providence St. Peter Hospital, and all the surrounding clinics is one button. It does pose some difficulty, and I actually saw on your neighborhood website a video from King 5 News that was posted about COVIDWA.com, and that actually seems like a really nice site that sort of puts this all in one spot and will let you know if any openings are available anywhere in your zip code. So check out your neighborhood site and watch that video. It's a pretty slick tool. But it is possible to use the vaccine locator to find when events are here. And just to let you know, the state did approve Albertsons, so I'm assuming that's going to be Albertsons and Safeway to be up here real soon to get vaccine, along with Costco and Health Mart in the state as well. So once we get it into our pharmacies, I think there's going to be a lot more access. We are in the initial phases of doing these vaccines. It's only been a little over a month and a half. Technology, it's basically learning from our mistakes, and I hope that it will get easier for everybody to register in the future. From that's I would love to take questions. I field questions all day pretty much at work from the community too. And I could talk about this for hours, but I did want to cut it off at some point so I can field questions from everybody. I do also have some resources. I'll make this PowerPoint available if you like. If you don't have a computer to sign up for a Face Finder or find a location, there are phone numbers here, which I listed, and they can help you sign up as well via phone. Also on the right-hand side is the link for Washington Listens. It's if you have someone you need someone's on the other line there to talk to in case you have stresses due to COVID-19. The number is there. It's 12 hours a day pretty much available. So there's a lot of resources the state provides. So do use them if you need it. You can also text 211-211 or text coronavirus to that number, and you'll receive updates on your phone about coronavirus from the Department of Health. So a lot of resources there. I have some resources from our CDC and the Washington Department of Health. There are updates, including some of the documents they put out recently. You can actually watch their live videos every week they put out there as well. And just some of the World Health Organization blueprints that were used in this PowerPoint today. So if you have any questions, you can always email me. It's dannyvrx@gmail.com. Just gave my home email address to you all. Feel free. I'll try to get back to you as soon as I can. If not, I'll take questions from the group right now.
Okay. Well, we do have a couple of questions up already from the panel. First is a question from Parker that wants to know why there are less side effects for older people.
Oh, so as you get older, your immune systems aren't as quite robust as maybe when you're 20 years old or 18. So what they've been finding is the first vaccine is providing large amount of immunity already, regardless of your age. So people, I know my grandma's 89 years old, just got her vaccine like 2 weeks ago. She did have she felt a little tired, did have an arm pain from her first dose. She still get her second dose. So you can still have those adverse effects, but with the second dose, your immune system's already done its thing. It's not quite as robust as it was when you're younger, and you get it, and you might not have a symptomatic response. You'll likely still produce more of those immune cells, but it's just not as rip-roaring to attack things that are a little foreign in your body. So it'll still provide great efficacy for any age. That is proven. So don't let that get you down. Just consider yourself lucky. So.
Okay, and then kind of a related question from Anonymous. Said they had a strong side effect from their first Pfizer shot, but her husband had no side effects from his Moderna shot. Can you speak to that?
Oh, yes. So everybody's a little bit different. Everybody has a different immune system. I actually had some physicians calling me saying, you must have handled the Pfizer vaccine wrong because I didn't get any adverse effects and my friends didn't either. Consider yourself lucky. Not everyone will get it. I can say they are about the same rate of having, sleepiness maybe, and tiredness and the arm soreness for both of them. Myself, I didn't have any adverse effects on the second, but on the first one, I did have, I think, a slight fever and a little bit tired for about 2 days, enough to go to work when I didn't have the fever. Everybody's immune system's different. I don't think the Moderna versus the Pfizer is you're not gonna be less prone to adverse effects with either one.
Okay, I'm going to ask a related question that's been on my mind. Nobody has posted this. And while I'm asking it, though, anybody else that has questions related to this or questions for Danny, please post them in the Q&A panel. So you've mentioned that there are multiple vaccines, and you can sign up for a variety of locations, but how do you know what vaccine that location is given?
So right now, not every location is listing what vaccine they have. I can tell you Providence St. Peter Hospital, they do list what their clinic is. It'll be Moderna first dose versus Pfizer first dose vaccine clinics that you can register for. I can't speak to the others. I do think at some point when the availability is a larger scale, you will commonly know what vaccine you'll get. Like I said, Providence St. Peter Hospital and the surrounding clinics, Prov Medical Group, we do list what vaccine you get. That being said, right now these are both mRNA vaccines. They're pretty much identical. Same technology, way different than the one produced in China that's used in Brazil. It's completely different technology. I believe that one makes the actual proteins. So they're actually putting the protein into the vials and sending it out. And then like the Johnson & Johnson one coming out, that is actually using this sort of lab engineered virus, doesn't live long, it's called an adenovirus. And it has that little segment of that little recipe in it that makes that protein be made. So it's a little bit different tech. I think those are going to be the big differences in just me being what I know about science with my biochem degree and doctor in PharmD and such. I think the mRNA is fantastic. The only reason we are able to get this vaccine within 1 year is because of this type of vaccine. We literally can print the sequence out in the lab, and there you go. There's the recipe book to make whatever you want, and your body can react to it over about 2 days. So I think what we got right now, either one is good to go.
Okay, I'm going to ask kind of an odd segue from that one, or joined. So you go in and get your first shot, and it's, let's say, Pfizer.
Mm-hmm.
So when you go in to get your second shot, are they keeping track of that, or do you need to keep track of what you got?
It is, they do give you a card. Kept mine on my fridge. As of right now, it depends what clinic you go to. I know if you went to a Franciscan hospital in Tacoma, they automatically sign you up for the next clinic for that one. With Providence, it's up to you to sign up for the next dose of the correct kind. They do ask for your card when you go, and make sure that you're getting the right vaccine. They have not yet studied if they are interchangeable yet. The one good thing is, so the Pfizer vaccine, you can get your second dose 3 weeks later. The Moderna one, you can get your dose 4 weeks later. That's how they studied it. They have both shown already that, you know, getting it up to 6 weeks later for either one doesn't make any difference. It's still great. And as of today, they're even showing that, hey, maybe even one dose is even good enough, but we'll see what comes with that. So, but right now it's up to you to make sure you get the same one.
Okay. So we have another question. Will they ever vaccinate children under 16?
I have heard that there are studies for this. You know, researchers, they don't like to study children due to the risks and can a child consent? Is it right for their parent to consent for their child to get this study drug? Never been tested. I have heard there are studies out now because, well, there's been 181 million doses in adults so far that are showing it's quite safe. So I think people are getting approval to do these studies with children. And once those are shown to be safe, I do think it will be available to any age at some point, but I wouldn't hope that I don't think it will be anytime soon. I wouldn't imagine it would be any time before the end of summer. So next school year, that'd be pretty fast to get that approval. We'll see.
Okay, now we've got a complicated one here. A 61-year-old female who had recurring cancer and is on immunosuppressant. What phase would she be in?
So that will be in the phase. It's coming up here. It's the 1B tier 3. So we're in tier 1. The next phase goes to anybody over 50 who's working in these high-risk settings, such as teachers and grocery store clerks and such. The next group is anyone over the age of 16 with 2 comorbidities. So if you're over 16, I know 61 is close to 65, but you don't get in earlier. I've had those calls out the hospital. I've actually had physician spouses saying, like, I'm working with people with COVID. I come home, he or she has comorbidities too. Can they get it? Unfortunately, we don't skip. We want to stay fair to the people highest at risk. And so you'll be up there soon. It should be this spring, if not early summer. So a month or two, I would say we'll be in that phase.
Okay, so now I've got an interesting one, and I think it relates to what you were saying earlier. What if you can't get your second vaccine when it's due?
All right, when it's due. Well, you do have that time period. If you get Pfizer, you have a 3-week time frame to go. I can tell you, I showed that one slide where there was 400-some thousand doses requested in Washington, and they only could supply 250-ish thousand. Well, and I saw in the news today, LA County had to cancel 12,000 second doses. Well, I can tell you Olympia have canceled multiple thousand doses. Providence alone, over 3,000 other second doses that were going to be this week due to the holiday and mainly due to the winter storm. So we'll be scheduling those next week. People will sign up. There'll be clinics for them the week after as well if they miss that one. So you do have that time frame. After that, there isn't anything really supporting getting it afterwards. So at this time, hopefully you get it within the 6 weeks. But I wouldn't fret too much. Literature of today showing, hey, maybe that first one's good enough. But I do support getting both of them and trying your best to get vaccinated. Okay. You do have a reservation sort of to sign up. It's only for second dose people to sign up for the second dose clinics. So it's much easier to get in than the first dose. We'll have a spot for you right on time.
So Mark had asked a question. I think we may have already covered it, but if you want to touch on again, if you get your first vaccine of one type, is it essential that the second one be the same type?
At this time, yes. I'm saying at this time because it is being studied if they can mix it up, but at this time, better go with what is shown safe and efficacious. Same dose, same type.
And we have a huge thank you from the audience as well. And one final question, if anybody else wants to get their questions in, now would be a great time. The final question that I had from the audience is, where's the supply shortage coming from?
The supply shortage is really the federal government. They have Operation Warp Speed. I mean, they've already given out nearly 60 million doses in this country in a month and a half. That's pretty incredible. You know, there's a lot of demand, and with winter storms around the country and such, sometimes there's shipping delays and things like that. So, you know, with researching up to the last minute for this presentation, I did see there's something like 100 million more doses going to be available to the U.S. In rapid fashion here. So it is from the federal side. The state is allocating out every single dose they get. Jay Inslee basically mandated that you give 95% of it in a week. You can't have more than 5% of it hanging out. And if you're one of those sites that are holding onto your vaccine, then you don't get any more the next week. So everybody's doing their best to use it 100%. And we're doing a really good job here in Washington doing that.
All right. And the one thing, my day job is actually in IT, and I would say that to everyone, please be safe in the sites that you look to find COVID information on, because there are a lot of unscrupulous people that will send you links via email and Facebook and a variety of other sources that aren't actually COVID sites, and they're just trying to get your information. And we all know how much we hate those phone calls, but the people keep getting our phone numbers. So when you're hunting for COVID information, I strongly suggest that you start at the Washington State site or to Providence, to known websites that you can trust.
Thurston County has a great site as well.
Absolutely. The .gov sites, you can trust those. Your whatever medical providers you use, whether it be Providence or your health insurance provider, you can trust those websites. But honestly, if it's a website that you don't know that ends in .com or really anything other than .gov, I would always be hesitant at clicking on a link. And if you get unsolicited links in your email, your Facebook, or other places, don't click on them, please. Just save yourself a lot of grief. Because as we know, with every disaster, there are those who try to profit from it in some way or fashion. And this is enough of a disaster on its own. Danny, I want to thank you so much for taking time out of your evening. I'm quite sure you've been having very long days dealing with COVID and dealing with all the inquisitive people. Thank you for taking time out of your busy evening and your downtime.
All right. Well, I appreciate you having me here tonight. Hopefully I was able to give all of you a little bit of information. And hopefully all of you can get your vaccines sooner than later. I can tell you I'm getting a shipment at Pfizer in the morning, so it's still coming.
All right, and with that, I'm going to move to the closing. Thank you, Danny.
All right, have a good night. Bye.
So hopefully everybody enjoyed the presentation. Big shout out to Lisa for contacting Danny for us. lots of good information. Some of it may be a little deeper than we'll understand. I know that I don't have a pharmacological degree. I did understand the basics, but definitely a lot of good information in there as well. This event was recorded. It's going to take a little while to get it downloaded and get it over to Mark and get it posted out on the website, get it on Nextdoor. Hopefully we can post it that it won't be too large. At bare minimum, we'll have it on the steam.org website, and we'll try and get it out on Facebook as well. I want to thank everybody that was able to make it, and I will thank those who watch this in the future. And I just want to say from your Griffin Neighborhood Association, thank you, and stay safe.